Once again, this is Dr. Hatem El-Aishi from Dr. Hatem El-Aishi Medical Center in Cairo, Egypt. Building the entire treatment plan for a patient with an autoimmune rheumatic disease. Our last video was about building the prescription only for the patient. Are medications the only way to treat an autoimmune rheumatic disease? No. Medications are not the only way to treat an autoimmune rheumatic disease. A medication prescription is so important, of course, for the management of the disease. I always tell my patients that the medication prescription is like the engine of the car. It is indispensable. But the medication prescription is actually the second most important factor in control of the disease and stopping its progression. Number one is definitely the GPS that we give to the driver of the car so that he/she reaches the right destination in the end. The driver is the patient. The GPS is patient education. Yes, that's very true. The doctor is not the driver. The doctor tells you about the favorable destinations, gives the prescriptions, and keeps supervising and supporting you, and it is you who will choose to drive the car to those destinations. You have a big say in your disease. So if the medication prescription is the second most important factor in control of the disease and stopping its progression, patient education will always be the first. What do we do in patient education? I need to talk to you and explain to you a lot of things. I need to explain to you how and why this disease happened to you, and why you especially got the disease, how we diagnose it, and how we treat it in general, and how we should treat it in your situation in particular. I need to answer all your questions and handle all your concerns. How about my coming years? How about my work and my career? Can I get into a relationship or can I get married? The duration of treatment, how long? Forever? Do I have to take cortisone? Can I stay active and productive, or will I get those deformities my grandmother had? Will I be able to take care of myself? What to do and what to avoid in every aspect of my life. I need to be there and help you cope and adjust to a chronic disease that happened amidst an active life full of plans and dreams that might now need to be revised or adjusted. Patients who are well informed about their disease and its management have more autonomy over their condition and are effective partners in the big treatment plan and have better treatment outcomes. No less important in patient education, because of course you will seek information about your disease also through the internet, I need to make sure that you get correct information safely about your condition through the internet. There are of course some really good resources about your condition on the internet. The rest of the resources are a big disaster. Either commercial websites that provide incorrect information to promote useless products and services for an arthritis patient that are not recommended by physicians, or some of the patient forums not supervised by doctors where patients give their own personal recommendations, not to mention the negative energy that is mostly diffused there. Getting disease awareness and patient education through your doctor are only one of several aspects of an effective doctor-patient relationship. In addition to decreasing the feelings of helplessness that patients might feel when being diagnosed with a chronic disease, effective doctor-patient relationship is the most important determinant of good adherence of the patient to treatment. Number 3, instructions for joint protection. There are general instructions for taking care of any joint in the body. One example of those general instructions, ensuring there's a balance between rest and activity. Another example for those instructions is making sure you use bigger muscles acting on bigger joints to do things rather than the smaller muscles acting on smaller joints, and many more general instructions. There are also specific instructions. For every joint, there's a list of instructions that are specific for taking care of that joint and reducing stress on it. One example of those specific instructions, for the knee joint for example, sitting with the knee in a semi-flexed position rather than totally flexed or totally extended position. Instructions for joint protection will also include counseling concerning nature of your job and its different tasks. Instructions for joint protection will also include counseling concerning nature of leisure activities and sports that suit your condition. Other instructions to quit smoking as it increases inflammation in the joints, don't get any vaccines without asking your doctor, contraception may be needed if you are using certain types of medications, fertility and pregnancy issues, follow-up labs, and following up with your doctor even if your disease is under control. All those are different types of instructions that you need to be given. Number 4, use of splints. If your body is tired of too much walking, for example, you might choose to lean on a wall. If your inflamed joints get tired quickly, give them a wall to lean on. Give them a splint. Those are examples of the different splints that we can use in a patient with an autoimmune rheumatic disease. Psychosocial management comprises listening to my patients and being supportive to them, screening for depression and anxiety or adjustment disorders, referral to psychologists if needed, and group therapy if that is at all possible or feasible. Number 6, diet instructions and weight control. Number 6, diet instructions and weight control. Diet instructions and weight control are not the same thing exactly, but they are related to each other. Diet instructions. You don't have to be overweight to need diet instructions. You can have an ideal weight, but your disease requires some dietary counseling provided by the nutritionist. Weight control. If you have arthritis, it is important to avoid getting overweight or getting obese for 3 reasons. Obesity stresses and overloads the joints of the lower limbs that are already inflamed by the disease. Obesity can sometimes cause resistance to the effects of some, but not all, of the prescribed medications. Obesity also compounds with chronic inflammation to increase the risk of cardiovascular disease, atherosclerosis of the blood vessels. How to achieve weight control? By diet programs provided by the nutritionist. You need to know here that diet ranks higher than exercise for achieving weight control. Number 7, management of the cardiovascular risk. In any disease where there is chronic inflammation, cholesterol can deposit in the walls of the arteries. In high-risk patients, certain measures are taken and certain medications might be prescribed. You need to quit smoking, you need to control your weight, you need to follow a certain diet, you need to control your blood pressure, you need to check your cholesterol and control it if you have high cholesterol, and you need to do some exercise. The very least is walking. Number 8, physiotherapy is about trying to restore the function of a joint to normal or as near normal as possible. Exercise, yes. Patients with arthritis can enroll in exercise programs and can participate in sports. There are specific sets of exercise types for each stage of inflammation. In very inflamed joints, we do only range of motion exercises and maybe what we call joint mobilization, loosening tight joints gently and cautiously. In less inflamed joints, we proceed to active exercises where the patient contracts the muscles and we add some little resistance maybe. With better control, we add more resistance exercises and start to do some compound movements where more than one muscle is called to action. The golden rule here: exercise within the limits of the stage of inflammation and within the limits of any pain that you might get. Never overdo things. Again, never overdo things. Participation in your favorite sport is very, very possible if your disease gets under total control. Number 9, occupational therapy. Occupational therapy it differs from physiotherapy is that in physiotherapy we try to restore the function of a joint to normal or as near normal as possible. In occupational therapy, we accept the fact that we cannot restore the function of a joint, but we start to see what we can do to connect you to the activity or the function that you need to do. As you see, it's mostly about assistive things that we are providing the patient so that he can do his activities of the different activities of daily life. Number 10, surgery. A list of surgeries can be carried out to patients with autoimmune rheumatic diseases, ranging from tendon repair to total joint replacement. Surgeries are done only to some of the patients who have more severe disease that had not responded well enough to other treatments. Now that was the end of the video describing the big treatment plan, not only the prescription plan, the big treatment plan for a patient with an autoimmune rheumatic disease.